Hello, everyone. This video is going to be a walkthrough of the general surgery and integumentary system sections of the CPT. I'm going to do a pretty broad overview of those sections, and then I'll go back and kind of go through a few of the most commonly cited areas that cause confusion or frustration. I'm not going to do a walkthrough of any problems at this point. I'll do that in another video, okay? So we are looking at our 2022 manual. Make sure you have your tabs, highlighter, pen, whatever you write with. If you are not yet writing in your manual, you need to be. So please, please, please write in your manual. If you haven't tabbed yet, get to tabbing, first of all. But we are putting our surgery section tab here on page 91. And that is where the table of contents for surgery and for both general and integumentary system start. So this is the start of the entire surgery section, but it's also where we see general and integumentary systems table of contents, okay? The integumentary system itself, those codes start on page 94. But the table of contents starts on 91. The surgery guidelines are the pages prior, which we went over in another video. If you have not looked at these, you definitely need to. They are very helpful, and they do apply to both of these sections as well as all of the surgery sections we're going to look at. So I wanted to start with the table of contents because particularly for the integumentary system, the table of contents is going to be the easiest way for you to find the proper section. So unlike other sections like anesthesia that I just went over, where the codes are laid out in a very logical anatomical fashion, where we're starting with the head, moving down to the neck, the thorax, and so on. And then have codes underneath related to those sections, that the integumentary system is not set up that way. It just doesn't make sense. Why? Because integumentary system is all of your skin. It's also going to be nails, hair, other structures as well. So since that covers your entire body, it really doesn't make sense for us to break that out into head, neck, thorax, and so on and so forth. So the table of contents is really, really helpful because it really directs you to the right procedure that you're looking for in the right section, okay? We'll get into that a little bit more here in a second. You'll also notice in the general section, there's only one main section. So the main sections are in red, and then subsections are here in blue. And general only has one, so it's fine needle aspiration, Fna biopsy. There's only one type of procedure in this section. We're still going to look at it because it is very helpful, but it's helpful for not just understanding this section, but for understanding kind of the structure of the whole manual. It's a really good example for us. So we're going to look at that here in a second. But what is important to note about this section is that only this procedure is in there, fine needle aspiration biopsy. So anytime you see that procedure listed, you need to go to this section, okay? And if you want to make a note of that, that's great. If you want to add a tab that says Fna biopsy, then that would be great too. So that starts on page 93. Here we go. I'm going to put that up there. Oh, there we go. Make sure your pen doesn't bleed like mine. And then also, if you wanted, I just wanted to point out that the table of contents for the integumentary system does go on to the next page. So it is a pretty large system. Just make sure you are aware of that. Okay, so in this general surgery section, we only have the Fna biopsy, and that is very important, but there's a couple other things that I wanted to point out that are really well exemplified in this section. First of all, you will see the explanation of this section right here. This is typical for the entirety of the manual. anytime you see a big, long explanation of something, you should probably read it if you're going to be using codes from that section. It explains what the procedure is. It explains how it's different from other similar procedures. So it's a really good explanation of why it has its own section, okay? The other thing that's really well exemplified here is this convention of out of sequence codes, okay? So what you'll see here is a bunch of codes that we would anticipate would be right here in this order, okay? These are the very first codes. And so we'd anticipate 10004, 05, 06, 07, 08, all being right here. But this red text tells us these codes are not in the right order. They've been moved elsewhere. And then it also directs you to where you can find it. Okay, so that's super helpful, and you'll see that convention repeated throughout the manual. It's just most obvious here and easiest to look at, so that's why we're looking at it. So for example, this would tell us, all right, 10004 is out of numerical sequence. Please see 10021 to 10035. So we come up here. This is very quick. Here's 10021. So this is where we know we're in the right section. And right underneath there is 10004. So this is where this code that should be over here has been moved up here under 10021. Okay. The other way you can tell, as you see here, here, anytime we see this pound symbol or hashtag, that is telling us that this code is not in the right sequence. So it has been moved from its original sequence. So that's also very helpful for us. And you'll see this convention throughout the manual. So we'll see that 10004. What the other thing that is unique about this is there's a plus sign, which I've kind of written over. Let me see if I can find another one. Okay, over here. On 10012, you can see that there is a plus sign here. And this tells us that this is an add-on code. So if you don't remember from previous videos, an add-on code is a code we cannot use as a standalone code. It has to be used with another code. It's an add-on code. And then if you look underneath this code, this is very helpful in this section. They have a lot of guidance here underneath the code. And it will tell you to use this code in conjunction with 10011, which is the code right above it. It will tell you do not report it with any of these codes, okay? So it gives you a ton of information about how to correctly use this code. So the way that this section is laid out is we have these parent codes is sometimes what they're called, these main codes, and then these indented codes are going to be the add-on codes. But basically what they're telling you is in these main parent codes, they're saying the fine needle aspiration biopsy, and then it gives some different specifications. So every code is a Fna biopsy, and this first one is without imaging guidance. If we went to the next not add-on code, this one's an add-on, so it can only be used with this other code. This next one, 10005, is not an add-on code. And it's Fna biopsy. This one includes guidance, okay? And all of these main codes are for the first lesion. And then the add-on codes underneath them are for additional lesions. So you would add on codes for each additional lesion, okay? And that same pattern is repeated throughout this whole section. It is an Fna biopsy, and it has some kind of specification here on the back pages, including CT guidance. And this one's including MR guidance. And then the add-on codes underneath it is for each additional lesion. So if you just had one lesion, you would use just the main code, but if you had 2 or 3 or 4, you would add on an additional code for each of those lesions, okay? And yes, you can add on, if you have 5 additional lesions, you can do, when you're listing it anyway, let me use it. So say we were doing 10005, 0.09. And then we had 5 additional. We could do it like this, or you could list this code out 5 times. Okay, both of those would be correct depending on the payer that you're working with. All right. So that's the entirety of the general surgery section. And the main reason, again, that I go through that is because it just has some really great examples of the conventions that you'll see throughout the manual. The next section that we are going to look at starts on page 94. It's the integumentary section. And as I said, this is looking at all of the skin, structures, nails, hair, all of that. So obviously there's not a lot of procedures we do on our hair, but there are a lot of skin related, skin and nail and cysts and things like that, that you are going to see frequently in healthcare, okay? And again, we do not break this out by location, anatomical location, when we're looking at the sections. The codes themselves will break it out by location, by anatomical site, but the sections and subsections themselves are not going to work that way. So let's kind of do a quick overview, and then we will go back and I'll go through some of the more common issues that I've seen. So we have our main section, which is just skin, subcutaneous, and accessory structures. So that's just a very general, your main skin, skin organ, okay? So it's most of your skin, right? And so this is going to be a fairly general section. And then the subsections are going to be the type of procedures. So we have introduction and removal. Remember, introduction is going to be when we take something external and bring it into the body. And that could be something like a injection, or it could be something like placing some kind of structure or marker or a device. So say you were going to have like a radioactive procedure and they had some kind of pellet they needed to place in your body in order to help with the guidance of that procedure. That would be an introduction, okay? Incision and drainage, this is often called IND. So that would be if we are draining some kind of structure in the body. If you have an abscess, you have a hematoma or something like that, that's what incision and drainage is. And that's what this whole section is about. Then we have debridement, which is going to be the cleaning of wounds. On the next page, we will get into paring or cutting. So this is for the removal of lesions, and we're going to deal a lot with lesions in this section. So the only point I want to make about this one is make sure that if you are going to use any of these codes, that it is documented as a paring cutting procedure, okay? Then we have biopsy section. Anytime you see a big long list of explanations, you should read, okay? And this is going to specify the different kinds of biopsies can be performed. And then once we get to page 99, there's a lot of really good images here, illustrations that help us understand the different types of biopsies. So if you are confused about different biopsy procedures, those can be helpful. On page 99 is where we get to the removal of skin tags. I only point this out because you will notice when we look at lesions, which we deal with a lot of lesions in this section, most of the codes will say except for the removal of skin tags. So that's its own section, right? And then we get into shaving of epidermal or dermal lesions. So those are more, those are not quite as deep as some other lesions that we might be dealing with. On page 101, we get into excision of benign lesions. And on 103 is excision of malignant lesions, all right? And we'll get into that a little bit more later. Then our next big section, remember when we go into red, this means it's a new section. We're dealing with a whole different not different really, but a more specific part of the body. And all of these codes are going to be related just to this part. So these are the nails. All of these codes are just about nails. So if you have any questions on your exams or your workbook about nails, you need to come straight to this section, okay? And that's, again, why we look at our table of contents, because it's easier than flipping through all these pages, right? We can go straight to the nail section. Then we have a new section here for pilonidal cysts, very few codes. Again, if you see that phrase, you will come and look at these 3 codes. Then we have a new introduction section. So this is going to be its own section of introduction. Remember, that is bringing something new to the body. The other introduction section was specific to the skin. Sorry, how does it? Remember how it was phrased. To skin, subcutaneous, and accessory structures. This is a general introduction section. And then we have a general repair section, and the repair is going to be closing of some kind of wound. This section has its own subsections. So we have simple, intermediate, and complex. And then we get into even more complex types of repairs, things that are very specific, such as adjacent tissue transfer or rearrangement, skin replacement surgery, which is obviously going to be a very complex procedure. It has quite a few codes associated with that. And then skin flaps or deep tissue flaps. And these are very complex, very specific procedures. So they do have their own codes and their own little subsections as well. And then we have an other flaps and grafts section as well. We have an other procedures, and these are still all going to be in that repair section. And then we have a pressure ulcers section. So this is repair of pressure ulcers. And then we have the treatment of burns. Then we get into destruction, all right? And we can go more into what this means later. But what is important to point out in these subsections, one, make sure you read this, is it is specified as benign or pre-malignant lesions. And then our next section is malignant lesions. Okay, so these have to be confirmed as malignant. Okay. And then we get into micrographic surgery, which is a very specific procedure. I would recommend that you read through it. You see how much I underline things and how much I'm writing. This is how I use the manual. So I would recommend you do the same thing. Okay. And then we have kind of a little catch-all section here for other procedures. Then we have a main section just for breasts. Breasts are obviously a very complicated structure. There is a lot that can go on. And so we are going to have a lot of codes related to this. We have some fairly general codes here, but there's a lot of explanation. So make sure you are reading through these. And the different types of biopsies are going to be covered here. So make sure you know what kind of biopsy you are coding before using one of these codes. Then we have an introduction section. Again, introduction is bringing something external and placing it in the body. With breasts, it's going to often be when we're placing markers or other kind of things to help with imaging guidance, okay? Then we get into, on 126, mastectomy procedures. That's going to be the removal of breast tissue. The main thing I would caution you about using this section is make sure you are specifying laterality. What does laterality mean? Are we looking at left or right or bilateral, which is both, okay? We need to specify that with a modifier. You would use modifier 50 if it is a bilateral procedure. Then we have repair or reconstruction. Again, a big, long explanation. And then we have an other procedures code. So that would be our unlisted procedures code right here. Okay. And that is the end of the integumentary system. And then we would have musculoskeletal starting over there. One other thing to point out about breast surgery, which I wanted to, it's come up before in previous courses, so I just wanted to clarify. Generally, plastic surgery is not going to be covered by insurance for the most part. There are some, such as reconstructive, that would be covered by insurance, but for the most part, anything that's for aesthetic purposes is not covered by insurance, and therefore we don't have codes for that. That doesn't mean that we don't have codes that include breast implants. We do, particularly if we are looking at somebody who's had a mastectomy or something like that. But if it's purely for aesthetic purposes, we will not have a code for that in this manual, okay? Because that's not going to go through insurance generally. So that's come up before. I just wanted to clarify it. Alrighty, so I wanted to go through a couple of things in this section to help clarify before you get to working on it. And the main things I wanted to talk about was lesions, because this is one of the primary purposes of this section is to deal with lesions. And lesions can mean a lot of different things. It's kind of a very broad term, but we deal with a lot of codes related to lesions. So the important thing to understand about lesions is there's really 3 different techniques that we can use to remove a lesion. We can do shaving, destruction, or excision. All right. So shaving is a fairly simple, straightforward right here. Basically, all you need to know if you are doing the, if you are performing or coding the performance of a shaving of a lesion, you just need to know the location and the size of the lesion. And that's pretty much all you need to know, because it does not matter if it is benign, malignant, pre-malignant, any of that. That's not required. It's a fairly small, not large enough to be concerned about cancer, it being cancerous. Okay, so shaving is one of them. You must have it documented as shaving if that's the technique that you're going to be coding. Excision means we are removing, we are cutting out the lesion. Okay, and this is going to include what we call margins, which is so that means instead of us taking just the lesion here, which you can see here, we are taking an area around the lesion as well. So we're taking some additional healthy tissue. Oh, I marked it up there. So we're taking some additional healthy tissue, and then we're performing a closure. Okay. And the way that we code these excisions of lesions is we go to the widest diameter that includes the margins, and that is the amount that we are coding. Okay, so when we look at the codes, it'll make more sense, but we always look at the widest diameter. So if you want to put that on here somewhere, looks like I already had it down here as well. That is the most important part of coding lesions. The other thing, like I said before, is benign or malignant. So if we're doing excisions, we are either listing them as benign or malignant. Make sure you know which one. They will try to trip you up on the national exam by giving you, because all the codes in this section and in the malignant lesion sections are very similar, almost identical. So they will give you, as some of your options, codes that look exactly the same, but the only difference is one is for malignant, one is for benign. So you do need to be very careful about that. And then the other thing I wanted to point out in this section, which applies to most of the other sections, is that even though our main sections and subsections are not organized by anatomical location, when we get into the codes themselves, they are organized by anatomical location. Okay, so what does that mean? So that means all of these codes, these main codes here that are not, see how underneath we have indented codes? these main codes are all pretty much exactly the same in terms of what they are, of what the procedure is. So they're all excision of benign lesions, including margins, and then they all specify except skin tags, as I said. That has its own section. And then the only thing that makes them different is that they specify the location on the body, so trunk, arms, or legs. Over here, scalp, neck, hands, feet, genitalia. Over here, face, ears, eyelids, nose, lips, mucous membrane, okay? So I would go through, as you can see I have done, and highlight or underline what makes these parent codes or main codes different, all right? If you can see that. There we go. And then these codes that are indented underneath, so these first codes are all going to say their excision of a benign lesion and includes margins. And then it's going to specify the location. So this one's face, ear, eyelids. And then it's going to say, if you just want to use this code, the diameter, so that widest part, needs to be 0.5 centimeters or less. That's what needs to be documented, is that the widest diameter is 0.5 centimeters or less, including the margins. These codes underneath, these indented codes, they are going to specify additional sizes. So if the lesion is bigger than that 0.5 centimeter, we would find where it best falls, okay? And that same pattern is going to be repeated throughout these sections, all right? So we have excision of malignant lesions right here. Then we have our nail section, which I already pointed out. Oh, another thing that I wanted to point out about these two sections is that simple closures are included. So if you'd like to write that, a simple closure, so that's just going to, they're usually going to say single layer closure, local anesthesia, something like that, that indicates that it is a very simple repair. That is included in these codes. If it indicates that it is a more complicated closure requiring some deeper structures, or even if it goes down to like the bone or something like that, that you would use an additional code for, okay? So make sure you read through these because that does explain that. But for the most part, if it is just a simple repair, that will be included in the code, all right? And then we get into the repair section. And again, here we have simple repair, and then there's intermediate and complex. I would read through the explanations of what a simple repair is, what a intermediate repair is, what a complex repair is, and then I would write yourself some notes in those sections. I've done that here. I've explained to myself, if I'm going to use these codes, this is the kind of documentation I'm looking for. A simple one layer. It just involves the epidermis or dermis, local or topical anesthesia, no or minor involvement of deeper structures. Okay, so it's going to be a very simple, straightforward procedure. Once you get into intermediate, this is going to say one or more of the deeper layers. It's going to require extensive cleaning, or it's going to require the removal of a particulate matter. So we're taking something out of the wound before we can repair it. That will be considered intermediate. That's the kind of documentation we're looking at in order to use these kinds of codes. Once we get into complex, I've made myself a note that says it would still involve the same things as the intermediate level, but it will also involve exposure of bone or cartilage or tendon, and it may require the debridement of wound edges, and then it may involve one of these structures, the vermilion border or a nostril rim, so more delicate structures. So if we are having to do a fairly extensive repair, something that might require cutting deeper in order to repair it, debridement, so the cleaning of the wound edges, anything like that, anything that exposes the bone or cartilage, that would be a complex repair, okay? So I would make yourself notes of that because this is definitely something you'll see a lot and will likely see on the national exam. And then the next thing I wanted to talk about was pressure ulcers. So that's one of the repairs that we've talked about in just this general repair section. Would be the treatment of pressure ulcers, which are very common, particularly in older people or people who are restricted in movement. Maybe they're bed bound. They have to be in their bed all the time. It's very, very common they would get pressure ulcers, and those can be very, very serious. So the one thing I wanted to point out about this is ostectomy is going to be removal of bone. Okay. So you would make sure if the documentation includes the removal of any bone, that you would use that code underneath the parent code or the main code. Okay. So that would be even more specific. All right. And then we get into destruction. And the thing I want to talk about with destruction is it is a fairly general term, and there's a lot of different procedures that go into destruction. It could be ablation, cryotherapy, electrosurgery, or cryosurgery, electrosurgery, a chemical destruction. Basically, the difference between excision and destruction is with excision, we are cutting something out and removing it in its entirety. With destruction, we are destroying it. So there wouldn't be anything to send to pathology. That's usually how I remember it. With destruction, we are not preserving any of that tissue. We're not moving it to any other place. We are destroying it in its location. All right. But there are a lot of different types of procedures that can fall into destruction. So chemosurgery, cryosurgery, electrosurgery, lasers, anything like that. Those are going to fall into the destruction category. So if you want to make a list for yourself and what that can mean, so that way, if you see that kind of documentation, it will help you, but I would definitely recommend it. So this will help you understand that a lot of different things can, oh, I misspelled cryo. There we go. A lot of different things can fit into this section, all right? And that's really the difference between destruction and excision, okay? So excision is going to be cutting, destruction's destroying it, okay? For both of these sections, though, you still need to know if they are malignant or benign. With destruction, we also would say pre-malignant. So you're going to be much more likely to destroy pre-malignant lesions in this section, okay, rather than doing an excision. So if you have benign or pre-malignant lesions, you have a section here, and then you have a malignant lesion section, and it's going to follow that same kind of pattern that we looked at before with the excisions, where we are looking at location, so destruction of malignant lesions in trunk, arms, legs, and then that 0.5 centimeters or less, and then these codes underneath are for larger lesions, okay? And then here's the same thing, destruction of malignant lesions, face, ears, eyelids, nose, lips, etc. Okay, so this is specifying it by location, anatomical site. And then we specify further by size, all right? So that's the main things I wanted to talk about here. If you are going to use any codes from this, Mohs Micrographic Surgery, please read through it. This is fairly complicated. The main thing you need to know about this type of surgery is that it is performed by one surgeon, okay? And it's functioning in two different capacities. It's kind of complicated, so make sure you read through this explanation, okay? Because if we separate out those roles, it's no longer part of this section, okay? So it's a little bit tricky, but usually if you see the documentation that says Mohs on there, you will be using one of the codes from this section, okay? So those are the main things that I wanted to talk about from this section. I will do another video to do a walkthrough of some of the problems, but I did just want to kind of give you some of the details that we look at in this very large section. I know it can be a little bit overwhelming, but I promise the more we work in it, the more it'll make sense. My main tip is to make sure you use the table of contents whenever you are working in this section, because I do think that is the fastest way to find the appropriate code. All right. So that's all I have for now. If you have questions, please post them in the discussion and we will go through them. Thank you. Bye-bye.